enter the room. So the first thing on your procedure checklist is to go ahead and knock on the door. So now I'm crossing the threshold here. Good morning, sir. Let me just set this stuff down here on the table. So my name is Andrea. I'm going to be your student nurse today. How are you doing today? Good? Great. So can I see your wristband here real quick? Just want to verify I got the right patient. And can you tell me your name and date of birth? John Sample, 12/5/73. Great. So, Mr. Sample, do you want me to call you John or Mr. Sample? John? Okay. So I'm going to be your student nurse today. I'm going to put my name right up here on the board for you. And I'm here to change your dressing on your leg. Before I get started with that, which will probably take me about 20 minutes, are you having any pain anywhere? No? Okay. Well, you let me know throughout the process if you're having any pain at all, then I can stop and give you a breather, okay? I'm sure your wound is quite uncomfortable. So at this time, if I needed to, I would ask somebody else to come in and help me position the patient. So if this was a sacral wound, I would definitely need somebody to hold the patient over for me. In this case, it's on the right leg, so I think I can do this without anybody assisting me. So I'm going to go ahead and put my gloves on, because I never know what kind of drainage might be on the leg here or on the blankets. You can already tell it's seeping through a little bit. Yep, it's gotten it a little wet here on the sheet. I'm going to raise the bed up. So I have good body mechanics, and put the side rail down. I'm also going to grab my garbage can. Okay. Nope, I touched the garbage can, so let me just change my gloves. Sorry about that, guys. So how's your morning been so far? Good. So I'm going to get started taking this dressing off. John, again, let me know if it bothers you at all. I'm going to start by peeling the skin, gently peeling the tape here, away from the skin, rather, and moving right down the wound. Just took a look at John, make sure he's not grimacing. Oh boy, John, this is probably pretty painful for you here. And I'm going to look at the drainage. So I want to make sure I'm looking at the exudate to make sure I want to note the amount. We usually quantify that in small, medium, or large. So I would say that's a large amount for this size wound. Then I want to note the color. In this case, it's serous sanguinis. So it's like a slight pink color. Probably a little more pink than it would be in real life, but serous sanguinis has like a watered down blood. Sanguinis would be bloody, which that is not what this is. And then of course purulent, which is your yellow, pussy drainage. So I would say this is a large amount of serous sanguinis drainage. To smell it, I'm going to make sure I don't put my face in the dressing. I would then walk, and I don't smell any odor with this wound. So then I'm going to go ahead and discard this dressing. So I need you to think of the concept of what your gloves might be containing at this point. You just reached in there and touched that wound. It's very dirty. There's a lot of microorganisms in there. I then know my hands are contaminated at this point. That's a really big concept to remember throughout the whole procedure of wound care. So I'm going to take my gloves off. wash my hands. All the while talking to my patient. John, so I'm just going to set up a couple of my items here, and then we'll begin cleansing the wound. So I'm going to bring my table up to the head of the bed. And it's really important that you don't turn your back on your sterile field. In this case, I'm going to do this wound sterilely because it's the harder of the two, so you can see both. Again, the steps are all the same. You're just either going to put on sterile gloves or clean gloves, depending on the procedure. So I'm going to arrange my environment. I don't need my order. I'm going to set that away. I do need hand sanitizer. I'm going to grab that. I need some gloves. I'm actually going to pull these right down. Set them right here. Okay, I've got 2 of everything, so I'm going to put my extra supplies. I don't need extra ones right now. Okay, I'm going to take 1 more minute to make sure I got everything. Perfect. I'm going to move my garbage closer. And I'm going to put it right here. Wash my hands. I got to give my hand sanitizer a minute to dry. So I'm going to go ahead and talk to John. John, you going to bingo today? Great. Going to win some money. Excellent. Okay, so I'm going to begin by setting up my measuring stick and whatever I'm cleansing the wound with. So I'm cleansing the wound with normal saline, like I said. So I'm going to open 1 4x4 to clean this wound. The easiest way to open these is to look for the arrow. I don't know if you can see that, Miss Candy. And then open it a little bit in the air. Remember, you can only touch the 1/4 inch border, and then you're going to pull it back kind of quickly away from you. That's going to be the first thing I'm going to utilize here, so I'm going to put it closest to the patient. I'm also going to open my measuring sticks. These always roll around, so always make sure you get more than one. Pretty good. I'm just going to set these over here. Now I'm going to grab my irrigant. So again, I check date, time, and initials. It's within the 24 hours. I'm going to palm it. I'm going to keep it above my waist, and I'm going to lip it. And I'm going to pour some onto my 4x4. Not too much. If you saturate the 4x4, then you just contaminated the whole dressing. So just a little bit, just enough to cleanse the wound. So because this is a sterile dressing change, I need to be sterile when I'm touching anything inside of the wound. So I'm going to go ahead and apply my first set of sterile gloves. So if I needed to, I could come down to the end of the table and open up my gloves that way. That way I'm not opening my sterile gloves over my supplies, but I actually think I'm going to be able to utilize the corner here without opening over any of my sterile 4x4s. And you guys know how to put the gloves on. Open the doors. You're going to pinch. And scoop. Thumb out. Okay, so now that I'm sterile, I'm going to make sure my hands are above my waist. And first thing I want to do is I want to measure the wound. So I'm going to grab my measuring stick. We always measure length, width, and depth. So I'm going to measure length from head to toe by hovering over the wound. I don't want to put my hands on the skin because then I would be contaminated. So I'm going to sort of hover over the wound. And then I'm going to hover over my measuring stick. About 9.5. For width, I'm going to hover over again. Hover over here. 7. For depth, deepest point of the wound, sliding down to the skin surface. And again, I'm going to hover. About 2. So then I no longer need these. I'm going to throw them away. And I'm going to begin cleaning the wound. So these 4x4s have 2 packages of 2 pieces of 4x4 in there. I'm going to go ahead and just drain out some of the fluid. I'm going to create a little, as Miss K&B would tell you, a little puff here. And I'm going to go ahead and cleanse the wound. In some situations, the wound might require a circular motion to cleanse. In this situation, I'm going to go ahead and use a distal to proximal motion to cleanse. We always go clean to dirty. So if there was a lot of slough in this wound on this side, that would be dirty because that's dead tissue. So then I would start on this side. So you really need to look at the wound to determine which way you're going to cleanse the wound. In this case, I'm just going to go from distal to proximal. 1 swipe, throw. And 1 swipe, throw. And again, like I told you in the first video, you may need additional items depending on the size of the wound. So maybe you need a big tub to cleanse the wound. So it really depends on the wound. I think I've got it pretty clean in this case. So now my hands are dirty. I've just cleansed the wound. They're contaminated. I'm going to go ahead and remove my sterile gloves. Wash my hands. Okay, John, how you doing? Okay? Great. Okay, getting rid of stuff. Making sure my table is nice and neat. And now I'm going to go ahead and set up what I need to actually pack the wound. So I've got 1 4x4 that's going to be wet. And because this is a wet to dry, I've got another 4x4 that's going to cover. That's going to be the dry part. So I'm going to go ahead and open that. The thing that I'm going to be packing into the wound is going to be closest to the patient, so I'm not reaching over my sterile environment. And then I need my irrigant. Set up my tape. Approximately the length of the dressing. Date, time, and initial. And now I'm going to open my dressing supplies. So I gave you a few 2x2s at home. I want you to practice opening your supplies without contaminating the edge of the container. Oops, like I just did. So that one just popped off in the corner, so I'm going to grab another one. And that's part of having a sterile conscience. So you want to make sure if you see anything that's going to affect the patient, you want to go ahead and grab a new supply. John, you doing okay? Great. Trying not to open over my already lined up 4x4. Palming my bottle, lipping again. Just enough to create the damp sponge. I'm just going to stop for a minute and just make sure I have everything, because once I put my sterile gloves on, I can't turn back. So I have that set up, I have that, I have my tape. I don't need my scissors. Okay, I think I got everything. So I got another set of sterile gloves. Now again, if this was a clean dressing, you would then just use regular standard precautions. But we're going to do it sterilely because that's the harder one. Let me just show you here too, if you had a lot of dressings, I'm just going to move down to the bottom here so you can see how you would open it down here. Just come down to the end and you open it down here. So depending on the size of your wound, you might have a ton of different dressings over here, and you might have to open your gloves down here. Same way I've shown you how to put gloves on since the beginning of the year. Pinch and scoop. Okay, my hands are sterile. I'm going to come over to my dressings. I'm going to first grab my 4x4, and I just want to squeeze it out a little bit. Remember, it should feel like a damp sponge. It shouldn't be saturated. We don't want to macerate the skin. We want to just provide a little bit of debridement. I'm only going to take one of these. And your fundamentals book says go ahead and undo it and fluff it up a little bit before you set it in there. It really depends on the type of wound. If this was just a surgical incision, you would just fold it and gently lay it over. But in this case, I am going to undo it and sort of pack it into the wound a little bit. And remember, you want one continuous piece. This is going to be just enough to fit. You don't want it to overlap on the edges. John, you doing okay? Oh, got a little tickle, huh? And then I'm going to grab my cover just by pinching and dropping. And then I can continue forward with my tape. Now, if your hands were really contaminated from packing that wound, then I would say you need to change your gloves again. You don't need to apply sterile gloves because once the wound is covered, it's then a clean procedure with the tape. But I didn't really get my fingers too dirty. I'm going to use my nursing judgment here, grab my tape, and go ahead and tape the wound. The tape around the wound should be in a postage stamp kind of, or a window pane, or however you want to look at it. It should make contact on all four corners of the dressing. In some dressings it might be occlusive and you might be taping all across the dressing. So again, it really depends on the type of dressing. Okay, John, I'm all set. I'm going to make sure I remove my gloves because they are contaminated. Before I go, is there anything else I can get for you or do for you? No? Okay, well, you have a good day, and let me know if there's anything I can get for you. Your call bell is right here. You put your side rail up and put your bed down and just get rid of my supplies. Okay? Great.